So the cost of dental implants, lots of questions about dental implant dentistry. So what affects the cost?
Well, I got a list of things here. The cost of the implant. There is about 200-300 implant manufacturers in the world, and there's probably only 4 or 5 of them that are mainstream, that are proven and well utilized. The second thing that affects the cost is how many doctors are involved. Usually, you need to go to another place for an X-ray. Then you need to see maybe another doctor for the surgery. And on occasion, you need to see another doctor to put the teeth on. And then you need to see a doctor that at the end of it all maintains it with you. All that adds to the cost. And having that all under one roof, having only...
So you do all that? You do the surgery, you put the teeth on top?
Yes, I do all that. We have the equipment and the training and the experience to do that reliably, yes. So another one is like the surgery that's needed. Sometimes all we need to do is place the implants. Other cases, we might have to do something with the bone, maybe do some bone grafting procedures if we need more support for the implants. That affects the cost. And then the lab bill. The lab bill, what the dentist has to pay to get the teeth made, is it plastic, what they use, or is it milled, or is it printed, is it made of porcelain? All these things will have an effect on their cost. Is the aesthetics worked out to a high degree or just average? Is it really customized or isn't it? All that has a cost associated with it. Another factor is the insurance.
What's covered by insurance for dental implants?
Well, I can tell you hardly anything. Maybe $1,000, maybe $2,000. And here's the thing with insurance. Insurance is intended to look after the average person's average needs. You do a cleaning, you need a crown, maybe a filling or a root canal. That's covered. But this level of dental care is not.
And that's throughout Canada. I know that's the way it is here in the United States as well.
Yeah.
Okay, so that affects it. And you say people are financing this. Is that right? Making payments on it.
Yeah, most people they finance it because it's a large investment to make, and not everybody has that in their back pocket, and we understand that. So we can set up payment plans that are affordable. Warranty and maintenance. Well, I look at it as my job. If I do my job right, and if my patient follows instructions and do their thing at home, keeping it clean and having us look at it now and again, we do take care of people.
So you're going to warranty the work. Okay,
you warranty the work for sure. Yeah. Another thing that affects the cost is, what do you want? If you need implants or want implants, do you just teeth that stay in on their own, like a full set of teeth, or do you just want your denture to snap in and snap out?
Snap in, snap out.
Yeah, obviously there's different price points for that.
Okay.
And that affects the cost. So it needs to be talked about. And then it's experience and training. I'm proud to say that over the years I've taken a lot of training, lots of experience. In the United States, I would be recognized as a specialist in implants. In Canada, we don't have the kind of specialty.
Okay.
But I'm confident with the level of service and the equipment.
So the goal is to get it done right the first time.
Yeah.
That'll save you money in the long run.
Get it done right the first time. That would save a lot of money in the long run, and also it saves a lot of headache and problems. And that's why when patients call and ask about how much are implants, I'd like them to go through a process so we can do a thorough...
Because it's not just that simple to quote a price on the phone.
No, it's not.
It might even be misleading. We talked about this in the green room.
Yeah.
Because you see these low prices on the internet. And they're actually quoting just a little implant. Is that true?
Yeah.
So you don't like that?
No, I don't like that. It's kind of deceitful. It's they say one implant is $9.99. That's just the start
so if they're
of it.
misleading about one thing, possibly what else are they going to be misleading about?
Exactly.
Okay.
I think patients are entitled to be informed and know everything up front before they get started.
So I guess you come in, get a consultation, an evaluation, an exam, some x-rays, and then you'll give them a price in writing.
That's right.
Before they leave.
Yeah.
They could shop that.
Yeah.
Whatever they like.
And whatever they do, they will need to come into some dentist's office and get the x-rays done and get the consultation done to arrive at a proper diagnosis and treatment. So might as well do it in our office, and then if you want to take that and shop around, that's fine. Yeah.